I want to welcome you to Rethinking Heroes.
Thanks so much for having me, Cary.
You are doing something that hasn't been done before. You spent your career studying the pharmaceutical supply chain. All of us are dealing with medical issues one way or the other. You've developed new solutions to ensure that patients, like struggling veterans, can get the medication they need at more sustainable pricing. And I have to say, finally, someone in your industry has jumped on a mission to create a fix for prescription prices, which can help labor unions, vets, and now all the rest of us. And let me just thank you for that. We have this cool Rethinking Heroes card that people can download for free. What does it do?
What we want to solve for is that drug pricing is so overly complex and opaque. And what we wanted to do is to provide people with access to a affordable price, a price that isn't manipulated, a price that isn't opaque or shrouded in other contingencies, a price that is actually provided by the federal government through CMS. So it uses what we call National Average Drug Acquisition Code, but that really doesn't matter. What's important is it's one price that you could look up. You could go to cms.gov and see the price of medication. And what's so important is that people don't understand drug pricing. And this has bothered me my entire career. Because think about this, Cary. Walk into a pharmacy and reach for a bottle of Tylenol or Advil. You understand the price immediately. But more importantly, when someone walks in right after you, the price didn't change for that person, or the price won't vary 150% or 200% or change day to day. And this bothered me. For prescribed medication, though, we have such a complex process. And unfortunately, it's because too many people are making money on the medication, not just the manufacturer, not just the pharmacy, all the invisible middlemen. And we wanted to remove this, simplify it, and very easily give people access to fair price again.
It is a moving target when you go see the doctor, et cetera. So this is like stability in an area where all of us, if you have high blood pressure, my cholesterol is very impressive. So I have to take, I know it's exciting. My triglycerides are even more magnificent. And I've lost a lot of weight and I'm fit now. It's genetic, my cholesterol. Here I thought, oh, I'll just get skinny and I'll be good. Now, take your Lipitor, shut up, go home. And it's expensive without a discount. So what we've got right now, if you go to rethinkingheroes.com, you're going to see this cool Rethinking Heroes card, and you can go into any pharmacy and there's no credit card thing. It's non-invasive here. People can just download it and use it and then go home, and it lasts a damn long time. It's for everyone.
That's just it. The only thing we do want to point out, is this isn't insurance and isn't to be combined with Medicare or Medicaid. But for people that have a benefit, it's great to see what a fair price is relative to your benefit. And for those unfortunate people that are in between insurance or are in a high deductible plan and perhaps can't afford their medication, again, having access to fair price. This is what bothered me as well, is that in order for an efficient market to work in the United States, buyers and sellers must freely communicate in price. And very simply, in what we're talking about in this particular example is the buyer is the patient, the seller is the pharmacy. But unfortunately, in the US supply chain, or fancy way of just saying healthcare for prescriptions, you can't freely communicate on price. Price is not efficiently transmitted. And so back to my example of Tylenol, if someone tried to sell you a jar of 60 capsules of Tylenol for $200, you would be like, no way.
Yeah, you're right.
If someone were to say your atorvastatin this week is $59 instead of $7, someone might be like, well, I guess so, because no one has access to fair price. And the game has continued for decades, and it's ending because of examples like this program, where now you have people that are providing fair and efficient access to a reasonably priced medication at the point of sale.
So as we're finishing up talking to AJ Loiacono, over 20 years experience in pharmacy benefits and finance and software development, having put together this incredible card for the benefit of you. So this is something we're making available. It's a free download at rethinkingheroes.com, rethinkingheroes.com, free download. no credit card needed, no fees, nothing. This guy is making it possible for us to get giant discounts at over 65,000 pharmacies. No questions asked. Enjoy it, get healthy, enjoy stabilized prices. And am I right in thinking like up to 80, 90% off medications that we're familiar with?
That's absolutely right. The example I just gave of, say, a torvastatin, 10 milligrams, 30 pills, on a vast array of pharmacies, that could be had for as low as $6.63. And that is a very reasonable price out of pocket. And some people will be like, that's an amazing price. Or lisinopril, 10 milligrams, 30 pills, $2.56. Like, wow, that's extraordinarily affordable. And the whole point of it is the price was always there. No one was willing to give it to the end patient because too many people wanted to turn that $2.56 into $22.56. And back to my earlier point, if buyers and sellers are not creating a free and efficient market, I don't understand price. And when that occurs, people manipulate and take advantage of the system. So it ends. And this is the program that can help this immediately.
You're a disruptor,
today.
my friend.
Pleasure.
We love disruptors. This is awesome. So you can stay alive for $5 instead of $500.
Exactly right.
Where do I sign up?
As you said, rethinkingheroes.com. You can obviously access the program directly, and there's no cost, there's no requirement. I just say the best way to shop is always to compare price. So no hesitation whatsoever. If you have this card, be it as a download, is it email, is it you want to keep it in your pocket as a physical printout, check the price. I always say this to everyone because unfortunately, there are people that will take advantage of you on every transaction. And this clears that up immediately for you.
Thank you so much for showing up for all of us. In a country of 350 million people, this is a tonic to a perpetually plaguing problem. That was a triple alliteration, and I did it just for you, AJ Loiacono with Capital RX, who's made this possible for all of us listeners. It's super easy. If you're a veteran and you don't have a printer, you can go to a public library. Anybody can. You can print the card right there, put it in your pocket, and like we said, no obligation to do anything, just save on it. Thank you so much for coming on today, AJ Loiacono. Appreciate so much your happy disruption, and a lot of smiles are going to be had, and a lot of people will get to stay alive at an affordable, sustainable price, which is something all of us want here in the US. Appreciate you coming on today very much.
Thank you so much, Cary. My pleasure.
All right, my friend. Cary Harrison with you. This is Rethinking Heroes, rethinkingheroes.com. Go there, check it out. Get that card. It's for free and for fun. Very much appreciate being with you, and I look forward to seeing everyone next week.
Rethinking Heroes with Cary Harrison. Life after the military. rethinkingheroes.com.